Primary care should be the backbone of the American healthcare system, but primary care is in a crisis. Hello, I'm Dr. Schimpff, and this is part of a continuing series on the crisis in primary care. Last time we talked about the paradox of American healthcare, our strong biomedical research on the one hand, which is the envy of the world, and yet a very dysfunctional delivery system on the other hand, which is not to our benefit. But today I want to talk about the real issue here, which is a lack of time. The crisis in primary care is, in my opinion, the most pressing, the most urgent issue we need to resolve in healthcare delivery today, much more than any other issue. So time has been lost. And why is time so important? Well, it's time to listen to the patient. It's time to think. It's time to diagnose and treat. It's time for care coordination. Time is really critical. If there isn't enough time, it means the patient gets sent off to a specialist when the primary care physician could have dealt with the problem himself or herself. It means there isn't enough time to build trust. It means there isn't enough time for good preventive care and just attention to wellness and health. Here's a story that I think might kind of put it all together. Susan, that's the name I'll give her, is 68. She's retired. She's a professional, on Medicare, happily married, and in good health. But she developed a strange sensation. It said it started here and it ran down her chest like this and sort of over into her abdomen. Described it as sort of a vibratory sense, just under the skin, sometimes a little almost electrical. Could come and go any time. If she developed it in the middle of the night and she woke up, that'd make her anxious. Sometimes she'd wonder if it's my heart. So eventually she went to her primary care physician who heard this story that I just told you, did the rest of the history and exam, which was perfectly normal, did an electrocardiogram, that was also normal. But now the 10 minutes that he had available for this patient was up. What she really needed was more time to figure out what this was coming from, which was really stress in her family situation. But he made the other decision, which was send you to the cardiologist, to the specialist. So she saw the cardiologist, who didn't find anything on exam or history, looked at the electrocardiogram, so that was normal. He said, but just to be safe, let's do a stress test, let's do a echocardiogram. So they were done, they were normal. Well, he said, I don't know what's causing your problem, but it does go down into the abdomen, so maybe we should see the gastroenterologist. So she went to the gastroenterologist, who did a series of tests as well, including an endoscopy to look down into her stomach and into her intestines. Everything was normal. And then she said, let's do a CAT scan, just see if there's anything that I've missed. They did the CAT scan. The CAT scan was perfectly normal, except in her uterus, there was a very small cystic structure. The radiologist read that as probably a benign cyst, but I can't be certain it's not cancer, so you ought to see a gynecologist. So her anxiety goes up. She goes to see the gynecologist, who says, I think it's just a cyst, but just to be sure, let's take it out. More anxiety plus the procedure. Now it's out, but she still has the symptoms she started with. The gynecologist sent her to a neurologist saying, it kind of sounds like a nerve sort of problem. The neurologist sort of chuckled and said, no, in the chest, nerves run this way, between the ribs, not up and down. So she still had the problem she started with, but she'd been to see a lot of doctors. She had spent, and her insurance company had spent a king's ransom. She'd had a lot of anxiety, but no resolution. This is the problem. This is the problem in primary care today. And it's really a pity. It's a shame. So that's our crisis. Next time I want to talk to you a little bit about what the causes of the crisis are.